Nurses in British Columbia voted overwhelmingly today to take strike action if they don't get a new deal from the provincial government. Negotiations broke down late last month. The CBC's Caroline Bargut joins us live from Vancouver on the story. So Caroline, the Nurses Union held a news conference last hour. What did we learn?
Well, we learned that more than 50,000 British Columbia nurses voted 98.2% in favor of job action. Now, the Nurses Union says that hasn't happened in 25 years. Now, they had been negotiating a new contract for the nurses over the past 6 months, but those talks broke down on April 20th. Now, the nurses say that they are concerned about a number of things, including unsafe staffing levels, what they're calling unsafe staffing levels, violence in the workplace, and occupational health and safety issues. They say that the province's hands-off policy when it comes to security is really putting them at risk. They say that this prioritizes de-escalation and that the nurses are now physically at risk because now they have to confront violent situations, and they say that security guards are really restricted in what they're able to do. Take a listen to Adrienne Gear. She's the head of the BC Nurses Union.
One nurse every 16 hours is assaulted on the job to the point where they require a time loss claim. Our injury rates have gone up 25% since 2019. Our psychological injury claims threefold. Nurses are holding this system together along with other healthcare workers, and we have not felt respected until now. And I hope today provides an opportunity for employers and government to take us seriously and know that we are not going anywhere.
Now, the Nurses Union says that it has submitted 140 proposals to the province. They say that the province only responded to 65 and only accepted 4, and one of those 4 was they agreed to correct a spelling error on the nurses' contract.
So what happens now, Caroline? Does this mean nurses are going on strike right away?
This does not mean that nurses will be going on strike in British Columbia. In fact, the Nurses Union says that they would have to give 72 hours notice for job action. One of the things that they could do is work to rule, which means that nurses would come to work on time, would take their breaks, and would leave on time. Now, the Nurses Union says that it wants to negotiate a new contract. It wants to go back to the negotiating table, and that the ball is basically in the province's court right now. They really want to be able to negotiate wages as well as benefits and be able to include things like physiotherapy and massage, the number of which they could have in their contract. Now, we did reach out to the province to see what their response was, and we have not yet heard back.
Caroline, thank you. CBC's Caroline Bargut live in Vancouver.